Hi everybody, this is Dr. Jody Stanislaw, and I'm going to talk today about all the different variabilities that could be changing your blood sugar levels during this time of quarantine. If you haven't seen me before, my name is Dr. Jody Stanislaw. I've had type 1 for 40 years, and I have dedicated my career to helping type 1s all over the world through my virtual practice and my online T1D training courses. And I also am a holistic physician, which means that when I work with patients, I want to make sure that all of you, all parts of you are doing well. Yes, I work with blood sugar level, but mindset, exercise, diet, all of those things, sleep. It's so important right now. We're having some challenging times worldwide. The unity is kind of cool, I think, I gotta say, bringing people together. And we got to take extra good care of our bodies right now, okay? The 4 pillars that I've talked a lot about in my videos lately: good sleep, good food, good exercise, and good emotional health. Hopefully you've watched my videos so you can be reminded about all the great ideas that we can do for those 4 areas. But today I wanted to dive into a few of the things that I constantly am working with my patients with through my virtual practice, and that is all the variabilities that we must consider in our lives, especially right now, that alter our blood sugar. So I've had type 1 for 40 years, so I'm not new to this game. And it's very frustrating to me when I've realized that a lot of patients have only been taught that, carb counting is the main way to manage their blood sugar. And yeah, I mean, we need to count carbs, but we also need to understand there's a lot more that affects our blood sugar level than carbs. So I'm going to dive into that today for you. Carbs can be fast, can be slow, low glycemic, high glycemic. You can be eating protein with it or not. You can be eating fat with it or not. All of this makes a difference. I'm not going to go into that today. I'm going to go into specific things about the quarantine that could be affecting your blood sugar. Because frankly, the topic of how many things can be adjusting our blood sugar level, there's no way I can fit in a 5 to 10 minute video. So if you want to learn more about that, which I hope you do, you can just check out my website, which I strongly encourage you to visit. Just Google Dr. Jody Diabetes and I will come up. My website is drjodyn.com, DRJODYN as in naturopathic, D as in doctor.com. And you'll see a bunch of free videos there. And you can even click on Let's Chat and we could have a live chat, which would be awesome because I love helping patients with type 1. But today I just want to mention 4 things that could be affecting your blood sugar level right now that I want you to think about. Okay? So lots of things affect our blood sugar level. But if you are eating differently than you normally do, that's obviously going to adjust your blood sugar level, change it. So you're going to have to learn how to dose differently. Maybe you're having bigger meals. You're going to have to dose differently. Maybe you're having smaller meals. You're going to have to dose differently, right? I teach this in detail in my course. I'm a big fan of what I call micro dosing. So micro dosing is really taking your insulin dose for your meal and spreading it out. And you really need to become an expert at that to be able to become an expert at type 1. But if you're eating differently, I hope you've already known that you either need to be less or more insulin. Microdosing is more of like the advanced step. Just figuring out your first dose is hard enough for most people, right? So, but microdosing is what I work with patients on to really understand that, our meals don't all of a sudden digest all at once and our blood sugar doesn't spike all at once. Sometimes it's a slow, steady spike over time. So be sure that you're learning how to make adjustments to your different meals right now. That's tip number 1, okay? You've got to adjust differently when you eat different meals. I'd love to help you learn more about that. Number 2 is, how's your stress level? We all know that stress can raise the blood sugar. So if you're having a lot of anxiety and who knows what else is going on in your life, COVID is not the only stressful thing in people's worlds today. I certainly know it's not only in mine as well. And so realize that stress, I just noticed the other day I was running probably 10 or 20 points higher all morning when I was dealing with something very stressful. Sometimes it's just kind of a mild increase, but other times it's a real intense spike. You get the phone call, you get fear, and you get the spike. So it is true. It isn't just food that raises our blood sugar level. Our own emotions can raise our blood sugar level. So please take a look on my page for my feed of all my other videos that I've been doing. I have lots of videos that go into ways that you can reduce your stress, which is so important right now. Okay, but that's step number 2, or thing number 2, not only step, that can be changing your blood sugar levels right now. Okay. Of course, the third thing is your activity level. You know, are you being more active right now? You're going to need less insulin. Are you being less active right now? Then you're going to need more insulin. I really encourage you to stay active. It's key for keeping our immune system strong. But you need to learn how to adjust your insulin, not only your mealtime, but your background if you're more or less active. So I'd love to help you with that if you don't know how to do that. And then, of course, step number 4 that could be changing right now is your sleep patterns. Are you staying up later? Are you getting less sleep? Are you getting more sleep, right? Sleep really does affect our blood sugar levels. A lack of sleep can cause a level of stress that lasts all day, and that can create a need for more background insulin. So, or maybe you're less stressed because you're not at work. So maybe all those stress chemicals aren't pulsing through your blood, and so maybe you need less insulin. So those are the 4 things I wanted to leave with you today, though. I want you to think about if your blood sugar levels are going wonky. Are you eating differently? Do you need to dose differently? Are you exercising differently, more or less? Are you sleeping differently? And is your stress level more or less? So those are 4 areas. Interestingly, they correlate with my 4 pillars of health that I often talk about: getting good sleep, getting good diet, getting good exercise, and good mental health. So I really want you to think about those 4 things, how they could be affecting your blood sugar level. If you want my help with making adjustments, you can take a look at some of my videos on my website, and you can even sign up for a free call with me. I'd love to help you kind of brainstorm and walk you through this. I work with patients all over the world. So I'm here Monday through Friday, keeping you filled with ideas for positive, motivational inspiration in these challenging times. Please leave a comment below if you like this video. I always love getting feedback. It's kind of funny just to be talking to my phone. I like to hear back from people. So leave a comment. I might go for a walk, or I might even take a nap. I just had lunch. I'm 132. My high alarm is at 120 because I keep a tight range. That's my goal. And so I might just go for a walk. So I just had lunch before this video, and so it's kind of going 120, 130. And so to avoid that, if you go on a walk, you can hopefully flatten out your post-meal spikes. I talked about that in yesterday's video, the 3 ways that you can avoid post-meal spikes. Or maybe that was Monday's video, I think. So thanks for watching. I love inspiring type 1s around the world, but please visit my website for more resources. Make a comment below what you like, any questions. And my website is drjodynd.com. That's DRJODY, N as in naturopathic, D as in doctor.com. And I'll be back tomorrow. So hope to see you then. Bye for now.